Hi everyone, and welcome to this week's Future Talk with Liz Buchanan and Shara Evans. Hello Shara.
Hello Liz, how are you?
Good, thank you. I enjoy these little chats. And so, what exciting little topic have we got today?
Well, you know me. I love talking about robots. They're one of my favorite types of new technologies. And given where the world is at with coronavirus, I've been doing a lot of research into all kinds of technologies that can help us fight the pandemic. And of course, robots are one of the technologies that fit into this purview. So today, I thought I'd share some thoughts on just a couple of different types of robots that are being used in the coronavirus battle and have other potential uses as well. So I'm going to share a couple of slides and hope all the slide sharing works as I want it to. A little bit of an experiment for our future talk shows. But let me first talk about one particular type of robot. And this is just an example of a robot that is used for disinfecting. And in general, there are two different kinds of robots that can be used for disinfecting. Robots that spray cleaning and disinfectant spray, but there are some limitations to that kind of robot, Liz, because you can't get into every nook and cranny with spray, and there are places that you really don't want to leave the disinfectant lying around. You know, can you imagine a kitty, picking up something and then, touching a disinfectant and eating it, and you can get really sick. So another kind of really exciting development in the robotics world that has been spurred on by the pandemic is the development of ultraviolet robots. And this is an example from Thailand. It's called Germ Saber, and it's remotely controlled. There are other robots that are similar that are completely autonomous. But what happens when it's on is that it shines really bright ultraviolet light, same as we get from our sun, but it's really good at getting into the DNA of viruses, bacteria, fungi, and all sorts of other nasties, and eliminating them completely. Oops, I'm going to stop that there and chat with you before I share the next slide again. But it's a really interesting development because I think it's a way that we can use robotics to help in healthcare facilities, in elder care facilities, in schools, in shopping centers, and maybe even in people's homes if someone's been really ill. What do you think of that?
It's potentially even a little bit safer in the sense that, sometimes when we're cleaning and we don't get all the spots, getting it with ultraviolet and so forth will make sure that it's just that safer, cleaner. It has those benefits, that's for sure.
Okay, so now I'm going to go back to my screen and share the next kind of robot that I'll talk about. These are just a few of many. Oops, it's gone too far. Okay, I wanted to talk about food delivery robots. Now, this robot looks like it's delivering food in a restaurant, but if you can imagine that this same kind of technology can be used to deliver food in a hospital where there are people that are very ill, or in an elder care situation, or other places where you really don't want to have humans come in contact with someone that may have a very highly contagious disease. Now, when it comes to robots, one of the things that I'm really big on is that they should not be used to eliminate jobs. They should be used to augment the things that we as humans are doing. And this is a case where I think we can actually team the two up, because you still have to have people that are preparing the food and putting the right food in the right shelves so that it goes to the right place, and of course making sure the robot delivers it to the right room. So I'm going to stop sharing this slide for right now and just go back to our little conversation.
Yeah, I see that. I see that as huge benefit. Last year, I did spend 4.5 weeks in hospital with my mum because I care for my mum. She's got dementia, but she was in hospital and she had to have surgery a couple of times. But the ward actually got some gastro in some of the rooms, so they actually blocked off the ward. And so when meals were being delivered, they were basically just left at the ward. And then eventually the nurses had to go, and then they had to robe up every time they walked into a different room. I see those the robots who can deliver it. Yes, they probably need to be sanitized each time, but it would alleviate so much time and getting nurses away from actually caring for patients.
Yes, and with the right technology, for instance, you know, just some electronics that let robots open up particular doors, and the smarts to actually push out the right tray at the right time in the right room,
yeah,
you can actually have it be a very effective delivery device. And there are, as I said, there are restaurants that are using this as well. They're playing around with it, but I think that it's much more beneficial in the context of a contagious disease than it is to necessarily just deliver food to your table for a gimmick.
Yeah, absolutely. See huge benefit. So what's the next robot?
Okay, so now let's go to the next one. Okay, and this is an example of a companion robot, and there are lots of them that have been on the market for a while. This one is fairly interesting because it has the ability to handshake, if you like, with the different data monitoring systems that are used to look after patients in intensive care and be able to provide alerts and so on to healthcare workers. And as you can imagine, in a pandemic, we have a shortage of healthcare workers, and we can't really have people that are looking at an individual patient on a 24/7 basis. So having a robot help to monitor vital signs and make alerts and so on can be really useful. This particular robot also has a touch screen where the patient can enter information or interact. A doctor could also, or a nurse could also look in through the robot's eyes, so to speak, at the patient and see how they're doing. There are lots of other companion robots that have different features as well. One that I really like has telepresence, where if I were wanting to virtually visit a relative or friend in a hospital, instead of the robot's face, you'd see my face up on the robot, and I could chat with a person who might not otherwise be able to have any company.
Wow, that again, that's huge benefit, but you can just imagine how much benefit it would be during coronavirus, considering of how many people have potentially been in ICU and then also died or passed away alone. Having that ability to be able to call and connect with them and even talk to them while they're in ICU is huge.
Yeah, as I said, you know, that particular robot doesn't have that feature, but I just wanted to show examples of different kinds of robots from around the world and talk a little bit about some of the features of the wider classes of these types of robots. And this is just the tip of the iceberg. There's so much more to talk about.
Yeah, there's going to be huge. And what we have noticed in the last 6 months particularly is a greater implementation of robots and everywhere. So I think that's, although you've been saying it for a while, I think we've seen a huge increase.
And I think we're going to see more and more. And perhaps next week we can share a little bit more about some of the robots being used to help keep our world safe.
Yeah, I think that's an important one. So next week, robots again.
I think that will probably be it. More on robots, but if you have other things that you'd like to hear about, let us know.
Beautiful. See you next week.
Bye, Liz. Thank you.